This recording will go over interpreting ABG lab values to determine acid-base imbalances. And this recording and PowerPoint presentation goes along with the worksheet titled Acid-Base Interpreting Lab Values. So you'll want to know what conditions cause what type of acid-base imbalances, right? Like we know that hypoventilation or a low respiratory rate causes the patient to hold on to carbon dioxide, which would cause the patient to become acidotic, right? The pH would drop down and we'd have a respiratory acidosis. And sometimes in test situations, you'll have a scenario that is just that, a word description of what's going on with the patient, and you need to determine what's going on, whether it's an acid or whether it's a metabolic or a respiratory, whether it's an acidosis or an alkalosis. Other types of questions have actual pH, carbon dioxide, bicarb, these ABG lab values listed in the question. And those are nice. Sometimes it's just the values alone. You have to determine what's going on. Sometimes you have a description of what's going on with the patient and these values, which is nice because then you can double check yourself. But when you're looking at these lab values, whether in the clinical setting or while taking a test, you need to be able to determine what's going on with the patient by looking at the lab values alone. So the first thing you have to do is you have to memorize the normal ABGs, right? So the pH, CO2, oxygen, and bicarb. And when we analyze these lab values, we're really only going to look at the pH, carbon dioxide, and bicarbonate to determine if the patient's experiencing acidosis or alkalosis and whether it's metabolic or respiratory. A common mnemonic that we hear when talking about acid-base imbalances is ROME. ROME stands for respiratory opposite, metabolic equal. And we've already talked about this. So when the patient's CO2 goes down, their pH will go up. So it's opposite affecting the body. If the patient's CO2 increases, right? So we have an increase of CO2 in the blood, as we see with hypoventilation, we're holding on to CO2. That would cause the pH to decrease. So the pH and the carbon dioxide will always be opposite of each other, respiratory opposite. Metabolic equal, whatever way the bicarb goes, the pH will go the same way. So when you're looking at lab values, you can use this as a way to help to easily decide if it's a metabolic or a respiratory condition going on with the patient. We're going to use the tic-tac-toe method. It's a good visual, and it also we're going to take it a step further in the future to look at the lab values and determine if the patient is uncompensated, partially compensated, or fully compensated, which just using ROME, we can't figure that out. But this is a quick way too where you can use ROME, look at the scenario, see if we have respiratory opposite, metabolic equal to try and determine what's going on with the patient. I personally feel that this ABG tic-tac-toe method is the easiest way to organize lab information to make it very clear for you as to what the patient is experiencing, whether it's a metabolic or respiratory, acidosis or alkalosis. The first thing you need to know is your normal lab values. Again, we're only going to be looking at pH, carbon dioxide, and bicarb. pH is normal, is 7.35 to 7.45. Lose the 7s for carbon dioxide, you got 35 to 45. Bicarbonate, I can buy beer when I'm 21, and the higher normal level there is 28. Step 2, you want to set up your tic-tac-toe chart. So one column is acidosis, one column is normal, and one column is alkalosis. I like to write at the top of every chart my normal values, and I arrange the carbon dioxide in sort of an odd way here. So let's look at this. Our pH is 7.35 to 7.45. I know if I have a pH in between these, it's in my normal value. If it's less than 7.35, it would be in my acidosis. If it's greater than 7.45, it'd be over here in alkalosis. Remember with ROME, respiratory is opposite. So normal carbon dioxide is 35 to 45, right? So if I have a 35 to 45 value, it'd be in my normal. Since it's opposite though, less than 35 would be over here with alkalosis. Greater than 45 would be over here with acidosis. And this can commonly get students, right? You forget to flip them. And that's why I like to always write it down to help me, look at it and remember exactly what I'm looking at. Then finally, bicarb, normal 21 to 28. Greater than 28 would be alkalosis. Less than 21 would be an acidosis. And I'm going to do a problem with you to show you how to work this. So step 3 is actually interpret the lab values, which we're going to do here. We'll do one together, and then I'll let you do some on your own, check back and see if we have the same answers. But that's arranging the lab information to determine if the patient is acidotic or has alkalosis, if it's metabolic or respiratory. So go ahead and pause the video to read the scenario. Now that you've read the scenario, looking at it, what are you thinking? Is the patient experiencing an acidosis or an alkalosis? You look at the pH here. And do you think it's a respiratory or a metabolic problem based on the description? So what we have here, it looks like we're dealing with a respiratory acidosis, right? We got a COPD, the pH is 7.3, which is less than that 7.35. What we'll do now is use the ABG tic-tac-toe to arrange these lab values to see if we are indeed correct. So it's a nice way to double check on these problems where you have a scenario and values. So now we're going to go ahead and arrange our tic-tac-toe. So let's see, we have a pH of 7.3. pH of 7.3 is less than 7.35, so it'll go over here under the acidosis column. We have a carbon dioxide of 68. Carbon dioxide of 68 is greater than 45, so we're coming over here to the acidosis side. And finally, we have a bicarb of 28. A bicarb of 28 falls within that normal 21 to 28, right? So this organizes the information for us, and it's very clear to see that the pH is acidosis, and CO2 would mean it's respiratory. Bicarb would indicate metabolic. Since I have CO2 lined up with the pH, that tells me it's a respiratory acidosis. You can pause the video and read the scenario. It's also on your worksheet that goes along with this. This type of scenario can be sometimes confusing for students because we got vomiting, dehydration, some metabolic type things going on, but we also have this deep, rapid, labored breathing, so respiratory going on, and it can be confusing for the students as to what the patient's actually experiencing. So these problems are great when they also contain the ABG values, because then we can double check using our tic-tac-toe method. All right, so go ahead and pause the video and figure out what exactly the patient is experiencing. Is it a respiratory or metabolic? Is it acidosis or alkalosis? So let's go ahead and fill in our information here. So the patient's pH was 7 being less than 7.35 comes over here on the acidosis side. The patient's carbon dioxide level was 23. 23 is not in between 35 to 45. It is less than 35, so it would come over here to the alkalosis side. Finally, the patient's bicarbonate is 12. Normal is 21 to 28. It's less than 21, being 12, so it's here under the acidosis. All right, and so now we can analyze what we have here. So our pH is under acidosis, so we know we're dealing with an acidosis. And the bicarbonate to us indicates metabolic. Remember, carbon dioxide means respiratory, bicarbonate means metabolic, so we're looking at a metabolic acidosis. So if we come back to our word problem here for number 2, we've determined that it's a metabolic acidosis. But again, this problem has a lot going on. So there's some metabolic things, there's some respiratory things. How do we know what's going on? So now that you know it's a metabolic acidosis, if you had problems trying to figure out what was going on, come back and look at what's happening here. So a big clue we have here is a 2-week history of polydipsia, polyuria, and weight loss. If you remember, there's a condition that is associated with the 3 P's: polydipsia, polyuria, and polyphagia. Do you remember what that one is? That would be diabetes. Okay, so we got some signs and symptoms of diabetes. This deep, rapid, labored breathing. What do we know about deep, rapid, labored breathing with diabetes? Kussmaul respirations, right? You got a patient with DKA who's trying to compensate with that deep, rapid, labored breathing. All right, we'll go to number 3. Go ahead and pause the video and read the question. All right, and now go ahead and fill out your ABG tic-tac-toe to see if you can determine what imbalance is going on with that patient. So we have a pH of 7.6, which is greater than the 7.45, a carbon dioxide of 31, which is less than 35 over here in alkalosis also, and then a bicarb of 25, which is within the normal range. So I filled in my information here, and looking at it, my pH lines up with alkalosis. I'm dealing with an alkalosis. CO2 represents respiratory. It's a respiratory alkalosis. Going back to the question for number 3 that we've determined as a respiratory alkalosis, what in the question sort of hinted to us that we would be dealing with a respiratory alkalosis? So the big thing here is that the patient was tachypnic. So they had a fast respiratory rate. Okay, so the patient is hyperventilating, whether it's because of pain or anxiety. That's what's going on. That's what's causing the patient's respiratory or acid-base imbalance.